Mr. President, today is an important step in a very long journey. Some 7 years ago, Obamacare passed into law. And in the 7 years Obamacare has been on the books, we've seen the results of this catastrophic law. We've seen the devastation that has resulted. Obamacare is the biggest job killer in this country. You and I and senators who listen to their constituents across the country have heard over and over again from small businesses hammered by Obamacare. As I have listened to small businesses in the state of Texas over and over again, they've described Obamacare as the single biggest challenge they face. Indeed, thanks to Obamacare, we've discovered two new categories of people hurt by the federal government, so-called 49ers and so-called 29ers. 49ers are the millions of small businesses that have 47, 48, 49 employees and yet do not grow to 50 because under 50 they would be subject to Obamacare, and subject to Obamacare they'd go out of business. There are literally millions of new jobs waiting to happen, waiting to grow, small businesses ready to expand, that Obamacare penalizes so punitively they do not expand. And by the way, those jobs that would be the 50th and 51st and 52nd are typically low-income jobs. They're jobs for people just starting out their careers. They're jobs for people that are minorities, that are African Americans, that are Hispanics. They're jobs for people like my father was in 1957, washing dishes, making 50 cents an hour, but glad to have freedom in this new country. And then there are the 29ers. The people all across this country forcibly put into part-time work at 28, 29 hours a week because Obamacare defines a full-time employee as 30 hours a week. People all over the country are being hurt. Single moms trying to feed their kids are being hurt because they've been forced into part-time work. So they end up working 2 or 3 part-time jobs at 28, 29 hours apiece. None of them provide health care, and the burden on them has been enormous. But it hasn't just been jobs, although that's a big part of it. It has also been the millions of Americans who've had their health insurance canceled because of Obamacare. We all know when President Obama looked in the TV cameras and said, if you like your health insurance plan, you can keep your health insurance plan. If you like your doctor, you can keep your doctor. PolitiFact, that left-leaning news site, labeled Obama's promise 2013's lie of the year. And it was a deliberate lie. As Jonathan Gruber, the architect of Obamacare, said, they were banking on what he called the stupidity of the American people, selling it based on a lie. And then there's the impact on premiums. President Obama promised the American people under Obamacare the average family's premiums would drop $2,500 a year. That wasn't just a little bit wrong. It was wildly and dramatically wrong. In fact, the average family's premiums have risen over $5,000 a year. People are hurting because health insurance is unaffordable. I hear from Texans over and over and over again, I can't afford health insurance anymore. And I will say that the harms from Obamacare, the people suffering under this failed law, have been mounting and mounting and mounting. And for 7 years, the Democrats have been content to do nothing. Barack Obama as president, Democrats having majorities in the Senate, did nothing for the 49ers who couldn't get new jobs, nothing for the 29ers, the single moms forced to work part-time, nothing for the millions of people who had the insurance plan they liked canceled, nothing for the millions of people who couldn't go see their own doctor anymore, nothing for the millions of people whose premiums have skyrocketed. And now, after 7 years of stonewalling and blockading and saying, we don't hear you to the American people, now our friends in the Democratic aisle are suddenly insisting they want to do something. Well, today we had a vote to take the first step in doing something, in honoring the promise that every Republican made to repeal this disaster. Now, the bill before the Senate is not perfect. No one would expect it to be perfect. Bismarck's comments about sausage making are certainly true in this process here today. But I will say the bill before the Senate that is not likely to pass tonight, but I believe at the end of the process, the contours within it are likely to be what we enact, at least the general outlines. There are at least 4 positive elements that are significant. Number one, it repeals the individual mandate. You know, the IRS fines about 6.5 million people a year because they don't have enough money to buy insurance. Now think about that for a second, Mr. President. You're struggling to make ends meet. You don't have the money to buy health insurance, and the IRS, not only do you not have insurance, but slaps you with a fine, millions of dollars of fine. In the state of Texas, there are roughly 1 million people getting fined by the IRS, roughly half of whom make $25,000 a year or less, nearly 80% of whom make $50,000 a year or less. The Democratic solution is if you don't have the money for health care, the IRS is going to fine you on top of it and you still don't get health care. That is a terrible outcome. This bill will repeal the individual mandate, repeal the IRS fines on 6.5 million Americans and the job-killing fines of the individual mandate. It also repeals the employer mandate, the driver of the 29ers and 49ers. For 7 years, the Democrats had no answer to the single mom forced to work part-time. Repealing the employer mandate provides relief to everyone who finds themselves in those camps. Number 3, this bill has a major reform allowing people to use health savings accounts, pre-tax money, to pay for insurance premiums. That means for millions of Americans, their effective premium rate instantly drops 20 to 30% by using pre-tax money. That is a major reform for empowering you, the consumer, to choose the health care for your family. And then number 4, the bill before the Senate includes the Consumer Freedom Amendment, an amendment I've introduced like the Health Savings Account Amendment, an amendment that says you, the consumer, should have the freedom to choose the health care that's best for your family. You should have the freedom, you shouldn't have to buy what the federal government mandates you must buy. You should choose what meets the needs for you and your family. And the Consumer Freedom Amendment was designed to bring together and serve as a compromise. For those who support the mandates in Title I, the Consumer Freedom Amendment says that insurance companies, if they offer plans that meet those Title I mandates, all the protections for pre-existing conditions, they can also sell any other plan the consumers desire. So it takes away nothing. If you like your Obamacare plans, those are still there. It just adds new options and let you decide, do you want the Obamacare option or do you want something else that's affordable? So rather than getting fined by the IRS, you can actually purchase something you and your family can afford. Now, our friends on the Democratic aisle have been unwilling to look at any options expanding consumer freedom. They just say it won't work. What we know won't work is Obamacare. We know premiums have risen over $5,000 a year. What happens with the Consumer Freedom Amendment? And this is critical, Mr. President. In the past 2 weeks, the Department of Health and Human Services conducted a study on the impact of the Consumer Freedom Amendment. They concluded, number 1, it would expand insurance coverage by 2.2 million people. Our friends on the Democratic aisle are constantly alleging that repealing Obamacare would reduce coverage. Well, HHS found the Consumer Freedom Amendment expands it by 2.2 million people. But what does it do to premiums? And this is powerful. HHS found that it will reduce premiums by over $7,000 a year. If you're a single mom, if you're a school teacher, if you're a truck driver, $7,000 a year is a lot of money. It's the difference between making ends meet and not, perhaps. HHS found specifically that for those choosing freedom plans, the less expensive options, premiums would drop $7,260 a year. But what about those on the exchanges? What about those purchasing plans subject to all the mandates? HHS found those plans would also drop. They projected $5,580 a year. So consumers benefit across the board with lower premiums. Now, Mr. President, this has been a process. At the end of this process, it's not clear what the Senate's going to pass, what's going to bring together and unite the Republican conference, because sadly the Democrats are not willing to help us provide more consumer freedom, to help us lower premiums, to help us provide relief to the 49ers and 29ers who have been hammered by this bill. But I believe the key to getting this done, and I believe we can and will get to yes. We're not likely to get to yes tonight, but we can and will get to yes, and I think the key to it is the Consumer Freedom Amendment if we are lowering premiums. If Texans, if Montanans, if people across this country are going home and seeing premiums $5,000 a year cheaper with pre-existing conditions protections, or $7,000 a year cheaper if you want a catastrophic plan on a freedom plan, that's a win for everyone. It's a win for conservatives. It's a win for moderates. It should be a win for Democrats. If Democrats were not engaged in this partisan fight, Democrats ought to be saying lowering premiums $5,000 or $7,000 is a win for our citizens. That, I believe, will be the key to getting this done. And let me finally say there is rhetoric about insurance companies. You know who loves Obamacare? It's insurance companies. Under Obamacare, the profits of the top 10 insurance companies have doubled under Obamacare. When you have the IRS fining people to force you to purchase their product and driving up premiums so they're unaffordable, Obamacare effectively sets up a cartel for the large insurance companies. What Consumer Freedom does is puts you, the consumer, in charge of your choices. Instead of the giant insurance companies, instead of the federal government, it puts you in charge. Freedom is the key to unifying our conference. Lowering premiums is the key. And I believe we can and will get this done. With that, Mr. President, I yield the floor.